For decades, dentists have leaned on a familiar pattern when presenting care. Educate the patient, offer treatment options, and then let them decide. It's clinical, it's well-meaning, but here's the truth. It's not working like we think it is. My surveys of thousands of dentists, general dentists, for over 20 years reveal that fewer than 10% of patients whose total care needs are $10,000 or greater are ready for care the first time they hear their case presentation. The traditional process for case presentation goes something like this. After the exam, the dentist shares clinical findings. Well, you got wear here, you got a fracture there, you got some bone loss in back, and then comes a short lecture on what caused it, often tied to grinding, gum disease, or old restorations. From there, treatment options are laid out, usually 2 or 3, ranging from ideal to the bare minimum. When the patient inevitably asks, well, what's this going to cost? The dentist hands the conversation off to a treatment coordinator. The kicker here? Many dentists believe they're fulfilling their duty of informed consent during this process by listing benefits, risks, alternatives, and consequences of no treatment. And technically, they are, but practically, too often they're overwhelming their patients. When we approach case presentation like informed consent, we create a cognitive dump zone. Patients not along, but internally they're spinning. The language is technical, the choices are complex, and the emotional context, it's often missing. No wonder they say, well, I want to go home and think about it. There's a better way to approach the case presentation. I call it the case conversation, as taught in my online curriculum, Treatment Acceptance Mastery. It flips the script. It's not about selling care or listing options. It's about influence, empathy, and leadership. Here's how it's different. It starts with the patient's why, their behavioral benefit. We reconnect what they told us matters most. Maybe it's feeling confident at the daughter's wedding or not worrying about breaking a tooth on vacation. It acknowledges fit and readiness issues. Life is complicated. Budgets and time and family. These factors shape how and when patients say yes. So instead of ignoring them, we build care plans around them. It separates the conversation about influence from the one about informed consent. You see, it's only after patients reveal the scope of care they're ready for do we shift into the formalities of consent. Now, here's why it works so well. For patients, the case conversation approach feels personal and manageable. They're not bombarded with options or pressure into making a fast decision. They feel understood, and that builds trust. It's emotionally safe, and that's what opens the door to acceptance. For dentists and teams, it reduces rejection and improves clarity. You're no longer guessing. You're no longer guessing what a patient can afford or handle. You're guiding, not selling. It also improves team handoffs. Once the patient expresses readiness, the financial conversation flows naturally. The bottom line, case conversations don't push patients into decisions. They guide them into clarity. And when patients feel clear, they say yes more often and more confidently.